Hello, everyone. Welcome to the pilot episode of the MedEqual podcast, where we talk about the representation of minorities in clinical trials. I'm your host, Kathy Thielen, and I'm co-hosting with Rian Jain. How are you doing, Rian?
I'm doing good, Kathy. Earlier today, we actually hosted another in-person event at the Patel Gurdwara. We had a fantastic turnout.
That's great news. I'm looking forward to the next event. I know we have a lot more planned. So, Rian, who are we going to host today?
Great question. Today, we have Dr. Hemal Patel joining us, a gastroenterologist who works in Northwestern medicine after receiving his education in India. So he's lived in both the United States and India. Before we start, Kathy, do you know what percent of the world's population is South Asian?
Yeah, I do. It's 25% or 2 billion, but it's a relatively small number in the US, 2% and increasing. It really puts into perspective how, when we focus on percentages, we forget that it still affects more than 5 million people. Now, without further delay, here's Dr. Patel.
Hello, Rian. Hello, Kathy. My name is Dr. Patel, Hemal Patel. I practice gastroenterology at Northwestern Medicine, as Rian stated. I did all my undergrad studies, including medical school in India. And then I came to the United States in 2004, and I pursued the medicine residency, followed by gastroenterology fellowship in adult medicine between 2005 to 2012. And since then, I have been in practice. I have been in practice a little over the decade. I have practiced in Michigan for a year, followed by about 4 years of a group practice in southern part of Wisconsin, just north to Rockford. And then I have been with Northwestern Medicine in the suburbs of Winfield and Geneva since 2016. So happy to join you guys in MedEqual. And let's see what type of questions you have for me this afternoon.
Thank you so much. That seems like a very amazing journey you've had. So tell us a bit about yourself, specifically towards the start. What drew you to medicine?
So that's a great question. I used to answer that question a lot when I was going through my initial interviews and stuff. I think what drew me to the medicine was probably my uncle, who is actually a pediatrician practicing in. He just retired, but he practiced all his life in the state of Illinois. Um, I used to see him often, and he used to come visit us in India when I was growing up. And he probably was the most inspirational person to think about the medicine. My dad is more of an engineer, he's a mechanical engineer, and he used to. Uh, I have his own small fabrication unit back there, so I have a lot of exposure, not in the studies, but in the sort of and how the machines and the machinery and the workers and what have you while growing up just by going to his workplace. But I think, the intricacy of medicine, the patient care, and the reward, I think what probably drew me to the medicine.
That's really sweet. Let's get into our main topic at hand. Dr. Patel, would you say that underrepresentation in clinical trials is a major issue?
We briefly talked about this with Rian when we had the introductory call, and I would agree. I would say, like, if I would see the lot of the studies which are being done in the clinical medicine and being published into the peer-reviewed journal, majority of the studies are I would say probably somewhere between 70, 80, maybe 90% of the population is mixture of Caucasian and African American, which is the two predominant population participating in studies. I would say probably less than 10%, maybe even less than 5% would be Asians, and out of them, Southeast Asian, maybe even lower. So definitely, I think there is an underrepresentation.
Yeah, that's definitely true. Like, when would you say that you first came to that realization? Was it prior to speaking with Rian? Did you see it yourself?
Yeah. Yeah, I mean, I think, it's very evident. I am more into the clinical practice of medicine, but I still would review peer-reviewed journals and original research articles from time to time. And often, if you guys have reviewed those research articles, the first, within a page or two, there would be something called the demographics, which means that, how was the population selected, and then what was the characteristic of the population. And if you just glance at it, you can just see that, what type of. So I think, I have been sort of aware about it. I think the thought process of you guys, MedEqual, kind of like, are more interesting that, why so? That why there is an underrepresentation and what it means and what we can do to improve that, I think is more unique to your group and what you guys are trying to do.
Course, of course. And I've read those studies too, and I think there's a level of intricacy that's lost when you write that study. Like, what does that underrepresentation even look like? Like, out in the field, in your experience, what does that look like for you? And what are the adverse impacts that can have?
So I would say, like, that's a two-part question. The first question is why there is an underrepresentation. And I think there are several factors behind that, right? First thing is, yeah, if you look, a lot of these studies are done at what we call all these academic medical centers. And often these academic medical centers are located within the cities. Um, and often the cities would have more indigenous population, somewhat of an underprivileged population at times who would participate or get gravitated toward the study. And I think that's kind of the reason why there is a majority of a chunk of the people is either Caucasian and African American. I think the other part of is also is probably, I think, just not being aware that there is such and such or so and so research studies or participation is available. And I think that is probably true on both sides. Which means that the physicians not being aware, especially maybe South Asian, East Asian physicians, and also the patients. I think that probably is combination of those two. Lack of physician awareness, lack of patient awareness, and the location of these research studies.
Yeah, that definitely makes sense. And what are the adverse impacts of that? Like, does it result in maybe adverse medical outcomes for the community? And how so? What does that look like?
Yeah. That I think, the one thing, the probably not much so of an adverse impact, but maybe that the studies um, may not be generalized to Southeast Asian population, right? Because the study was done predominantly on Caucasian African American individuals. So the results of the data, then you try to generalize to the whole group, and that may or may not be true, right? So it's probably not so much of an adverse impact, but probably could be potentially an adverse impact that you're trying to um, study a medication or effect of some medication, and it may be truly different in Southeast Asian population, and you just do not know that because that population was not included or was not a major percentage of the study population.
Okay, so like with that in mind, like what if like you were a community leader, but like you weren't from the medical field? Like why should the community leaders and why should the community care?
I think, the community should probably again care because that is how the field of medicine advances by the research. So the new uh, it could be a new medicine, it could be a new a treatment strategy. It could be a new intervention. And all of those, again, gets first analyzed into these research articles. Often, if it's a medication, it gets tested on the animals. It's a phase 1, phase 2, phase 3 trial, etc. And then ultimately it gets out to the general population. And if the technique or the medicine or the procedure has not been studied in one particular group and then later get applied to this group, as Rian alluded a question in the previous topic, that there may be potentially an adverse outcome, that you're expecting some good results with the medicine, and that may not be true, and that can potentially lead to some problems. So I think that's probably a good thing for everybody to aware of, a shortfall, if you will, of that research article, that it was not studied in this particular research, particular group of individuals, and now you're trying to utilize it for everybody.
I would agree with that. So, with that in mind, which conditions are going to be more likely to afflict South Asians and Southeast Asians?
So I think, again, of one thing which um, not related to field of gastroenterology, but I have seen in my practice over the last decade is diabetes and cardiovascular problems. I think a lot of times uh, both of these conditions are affecting South Asian population because of two reasons. For diabetes, I would think that it is related to the diet. The diet is predominantly rich in carbohydrates and probably refined sugars, which will lead to increases the risk of diabetes. And unfortunately, with the westernization, everywhere there is a less and less physical activity. Unfortunately, there is some obesity. And both of those will create an environment in our body, what we call the insulin resistance. Collectively, a lot of these terms are also coined as metabolic syndrome, which then increases the risk of individual to get the diabetes. And also there is a lot of research that Southeast Asian population have actually narrower caliber of the coronary arteries, and that increases the risk of early atherosclerosis and heart attacks. So I think those are the two conditions which I think uh, have been relatively of major interest in recent years, that affects quite a few. I wouldn't say predominantly, but quite a few Southeast Asians without very defined risk factors. A lot of time, obesity, high cholesterol, etc., are looked at the predominance for the atherosclerosis and heart attacks, and those may be absent in this South Asian patients, but they still would get early heart attacks.
Those are some interesting patterns that you mentioned with the diet and the lifestyle. But those are things that you see, like, in your practice here in the United States. Like, what is the situation like in India, both for like general healthcare and also like clinical trial representation? Like, are we seeing any differences in India versus the United States?
So that's a good question. I will say that I have not practiced in India now for over a decade. So I think the things which I know and I would say probably are a little bit older. So that's one limitation of answering that question. I would think that well, one thing I would say, I'll take a step back and answer your first question, that the prevalence of those conditions in India, I think it is getting higher actually, and I think that has a lot to do again with the diet and the physical activity, because the westernization is affecting India, even though there is a dichotomy in the the financial market, so to speak. There are more rich and more poor. There are population which is eating a lot of Western foods, and a lot of physical jobs are getting lower and lower. So I think people are working more on their computers. They're getting busier. There is more work demands, which limits their ability to do the physical activity. And I think, again, they are also getting into this perfect storm of metabolic syndrome and getting early heart attacks. In terms of their research and representation, I would think that India is also leading a lot of original researches, and if the original research is conducted in India, that would definitely increase. That would definitely, be predominantly represented by South Asian population.
Yeah, that's definitely true. And unfortunately, from what I know at least, a lot of original research is conducted in the United States, and then that's like kind of becomes the brand name drugs. And then after the patent for those has expired and more people can create it, that's when other countries like India start to kind of take up the
Sure.
production of it in the generic drug form. And it's really interesting there because if we had more brand name drugs being created in places like India, you definitely see a lot more representation to your point. But yeah, it's definitely a problem. And now that
Yeah, I think the only probably the silver lining into that is there are some companies are realizing this to some extent, and I think they're trying to conduct what they call the multi-center studies across the boundaries. So I think that can help a little bit, but then it's also limited to some extent by the FDA and the stringent restrictions by the FDA of patient inclusion and how the studies are being concluded or conducted, I should say, and then how the data is being collected. So I think that is some limitation because of various, government restrictions and what have you. But I think that is one thing I have seen at times that, especially for like some techniques, if they're trying to research, they may try to do multi-center studies across the nations.
yeah, that's definitely true. But I mean, the fact of the matter is that right now we're not seeing that same level of representation in the United States. So I really want to hone in on the reason for that. I mean, earlier you talked about how in cities it could be like the differences between people living in certain cities and those cities having a different composition of races. But I want to talk about like overall, why aren't we seeing that same level of representation? Why are so few South Asians participating in clinical trials?
I think that's a great question. I think I think my feeling is I think it's probably still going back to those two things which I alluded. I think one is probably the location of these studies being conducted, where I think in terms of South Asian population, there may be more younger individuals staying there who may not have a lot of healthcare needs. I think that's one thing. And then the second thing is also, I think, not enough clinicians, especially probably the South Asian clinicians, being aware about the research studies and not referring their patients to the research when they need it.
Yeah, that definitely makes sense. Could it also be that the community doesn't trust the trials that are being conducted? Is that maybe an issue?
I think that's always an issue, right? I think as a general population, I think when somebody just for an example, if somebody's sick with X, Y, and Z illness, and if a doctor says that, hey, we have one treatment which is approved by FDA, but we have one another research trial which we're just trying to see if it works or not. So I think it's just a matter of representing what that thing is, right? Often people do not realize that these research studies are actually already have gone through the phase one and phase two trials, and they have already shown to be an efficacious, as good, or maybe better than what an existing strategy is. I think it's population not being aware and not trusting this research. I mean, a lot of times research, as the name suggests, people would think that somebody's going to experiment them on them, and they do not want to be the guinea pig. So I think that definitely is out there. I would agree.
Yeah, definitely. Are there any other generational or cultural barriers that might play into the lack of clinical trial representation?
I think there that also partly like I think the younger generation probably is more worse with uh, the clinical trials and what gets done in there and how they're conducted and what could be the outcome as opposed to probably a generation before. So I definitely think that I think with the newer generation there is definitely more awareness and perhaps enthusiasm to participate into the research programs.
So, like, how could the healthcare sector like focus their efforts? So far, what has proven to be effective?
I think what probably is most effective, I feel, is probably the researcher informing. First, I think there are two parts. One is referral. So let's say that if a new medication for acid reflux is being researched, I think enough physicians needs to be aware that such new medication is being researched, and then they need to be aware that what is the new medication, how is it, how does it compare to existing treatment, and what are the advantages of the new medication over the old medications? And once a community physician is aware about all these points, then they can talk to their patients that, hey, you are on an regular XYZ medication and you are not getting better, but we have a research which is uh, which is experimenting this new treatment, which has already been shown to be effective on animal models. And I think it can be a great option for you. So I think when it comes from a physician who is fully aware about what research is being conducted, and then he talks to his patient and then refers, I think would probably be the most successful way of increasing the population participation.
Yeah, I mean, I was gonna ask, if you personally, as a physician, as a doctor, could change one thing to improve representation, what would it be? But you've definitely said like you personally reaching out with the patient directly is definitely a successful example.
Yeah, I think, and sometimes, not every time, there may be an opportunity for the physician to interact. But I think as long as more and more physicians are aware about such research, I think they can refer more and more patients to the such research wherever it is being conducted. It could be where they are practicing versus away from them, because now, luckily with the digital platforms, some of the things are getting easier that the participant may not need to travel miles away to participate in the research. A lot of things can be done over the digital media. So I think that is one exciting thing potentially.
Yeah, that definitely makes sense. And I think that's definitely the point we have to focus on because we have to make sure the community is aware, whether that's coming through physicians or other initiatives. I mean, our organization, like MedEqual, we've already like started trying to take action there, hosting events at places of worship with the goal being to talk directly with the community members and raise awareness about the problem so we can get their support. But what else? What else can student-led organizations like MedEqual do to improve the situation?
I think that's a great question and thought. I think one thing which I think what I was just saying before, that again, that researches are being conducted at the academic medical centers, not necessarily, and hence we are thinking that more indigenous population is participating because that is their catchment or the draw area. But let's say if you or like your organization is aware about an research which is being conducted for, let's say, like cholesterol medication. And if you promote that so and so medication is being researched, if you have a high cholesterol, please reach out to this number. So if you acquire those information from the research centers and disseminate it in the community, I think it can be a great way for community to be aware, because again, if you're reaching out directly where the population goes, such as the religious centers, maybe local grocery stores or local gatherings of South Asian population, I think that can truly increase the South Asian population participation, because at least it will catch more eyes, and it will just that probably will initiate the talk between the patient and their doctor. The patient or individual may not directly call the research, but they may ask their doctor next time they go that, hey doctor, I saw so and so information when we were at the temple the other day. What do you think about it? And I think that will probably help the doctor to then look into it and make an actual referral that, hey, yes, that is probably a great alternative for you, because you do have cholesterol and the regular medications are not lowering the numbers as one would expect. So I think that's one really good way for MedEqual to probably reach out to this academic research centers. Like, we have planning in the Chicago area. There's Northwestern, there's University of Chicago, there is UIC, Rush University. And a lot of times there are research coordinators who are actually looking for more and more research participation from the community. And then if they give you an information, like, a one page flyer, you can disseminate it to all these places you just mentioned.
Yeah, definitely. And I know a big issue that's been faced is the kind of a little bit of apathy. And I know we're going to face that regardless, at least to some degree. But do you have any advice or tips on how we can reduce that? How we can make sure that the most people who see our message remember it well enough to then take it to their doctor, as you mentioned?
It's, I would say probably keeping the message simple, I think would be very important, because I think um, you both are aware that, the general person's attendance to any informational flyer is less than 10 seconds. I believe that is actually researched. Could it be even less? So I think it definitely has to be something not very less verbiage, very to the point information, and then maybe a QR code or something, that you think you could be a great fit with the picture, and we'll be happy to provide you more information. And maybe they can enter their cell phone number or email, and you can then subsequently send them more information. So I think using the newer technology, the digital world, I think can definitely help to increase. I think once person has an attention, I think then the next step would be to get them to that information and have them participate. I think would be the next steps, and probably perhaps the digital technologies can help.
I did like how you mentioned the digital technologies and like the attention span of the person. Like, definitely, like, in order, like, if we are going to reach the community, like, we do have to consider like that stuff as well. Like, even just like human psychology. Thank you so much for coming out and talking to us today. Before you go, we do have some fun questions. I was really wondering, what is a healthcare home remedy that you've heard in your childhood that isn't true?
And that's great, interesting question. I mean, there are plenty. Perhaps probably one I can tell you is while growing up, my parents were convinced that drinking or eating anything with the bitter taste will help us to prevent the fever and illnesses down the road. Up to the point that they were making some juice of bitter gourd and at least forcing us to drink a teaspoon every single day in the morning.
That sounds so
True.
delicious.
Yes. Um, I do not think that that was true. They definitely had a good intent at their heart to help us stay healthy and avoid any illnesses. But I mean, there are plenty of those things out there.
Thank you. Yeah. Could we ask you for one piece of advice for teenagers out there?
Well, I have a teenager son, so I definitely have a lot of advices. But I think one advice I can give to all teenagers is meet people. I think, I feel that we in this digital world are losing some human connection and human interaction. So I really want all kids, teenagers, and younger to be just out there, meet people, interact with people, talk to people, have some friends, have fun. Of course, have funs on your digital iPads, iPhones, or whatsoever it could be. But I think talking to each other, playing out a little bit, I think all that helps to build a strong character in an individual, which goes a long, long way in life.
That was very insightful, Dr. Patel. Me and Rian, we're very grateful that we could speak to you today. I think that we've all learned lessons on how to improve representation and awareness in our community. Thank you for your time and have a
Yeah,
great evening.
thank you. Thank you again. It was a pleasure for me as well to be here with both you and Rian. And I think you guys are doing a great initiative, and I think it would really help the community to improve the various outcomes, health outcomes, research outcomes, and yeah, happy to participate and happy to move forward the good cause.
Thank you. Thank you so much for your words. I mean, you don't know how much it means to know that what we have here is meaningful. It's actually making a change. So again, thank you so much.
Certainly, certainly. Good luck to both of you
Thank you.
and MedEqual.
Well, that was really informative. I liked when he mentioned the increasing obesity and diabetes rates in South Asians, both here in the United States and in India. Like as lifestyles, as sedentary lifestyles increase and we see higher rates of those diseases, it's more important than ever that we have accurate drugs and accurate clinical trials. What do you think, Rian?
No, definitely. I second all of that. I found it really interesting though when you also mentioned that all we have to do to improve that representation is directly speak with the community because they want to participate in these clinical trials. They just don't know about them. So all of our direct community engagement will be extremely effective in making it so that they take the step to take those clinical trials to their doctor, say, how do I participate in that? And then get all the information to improve that representation. I feel like it's a really simple thing and it's often overlooked, but it's something we can do to improve that representation. Speaking of, be on the lookout for upcoming informative events around the community. You can stay updated by following our Facebook and Instagram, and help us out by sharing this podcast with your friends, family, and doctors.
Awesome. Thank you all for listening. Until then, stay curious and stay locked in.